Namaskar, viewers, and Dr. Anand Chaudhary. Uh, we are talking to Dr. Anand Chaudhary from the very specific treasure of our nation point of view, that is Ayurveda. Bharat nation is known for its Ayurvedic medical treasure. Somehow, there is a lot of debate and misunderstanding and myths about it, and there are people who do not want to promote it, and there are people who are very much in favor of this. So we want to understand that since it is not documented, people think that it is not the right way of treatment. So we want to understand from the expert about this. So first of all, let me welcome Dr. Anand Chaudhary. Sir is HOD of Ayurveda in Banaras Hindu University, Kashi. So none other can give us a proper guidance and vision on this topic. So sir, आपका बहुत बहुत स्वागत है और धन्यवाद आपके समय के लिए।
धन्यवाद मैडम, ये अपॉर्चुनिटी देने के लिए। तो सबसे पहले मैं बता दूं कि यहाँ पर फैकल्टी ऑफ आयुर्वेद है और उसके 16 डिपार्टमेंट हैं, and out of 16 department I am just a student of one department, that is the department of Rasastra and the Bashas Kalpana. And of course, what you said, that the people are thinking that it is not documented, so it is not rational. So with due regard to all those people, and I can say only one thing, is they are very much ignorant about the Ayurveda specifically. See, everything in country Bharat, or you can say the India, is documented. If we come to the all its knowledge, that is the traditional knowledge we call nowadays, right? For the engineering or for the cosmos or for the vastu or the for the jyotish or the anything. Likewise, here is also a very good treatise of the ancient time, like Charak Samhita, Sushrut Samhita, Stang Hriday, and the many more. Even I can say our roots are in the Ved, and specifically the Atharva Ved. So everything is here which is documented, and the point is what they call nowadays documentation, that is the research of the 100 year or the 50 year, and this documentation is since last 1,000 years. So it is documented undoubtedly. Now the interpretation and the understanding or the definition of the documentation is changed. So you have to see, if I say Bible is not documented, who will listen me? If I say Quran is not documented, if I say Gita is not documented, so every verse of the Bible or everything is the Bible is nowadays people are following.
Yes.
So that is the kind of documentation what we have in the Charak Samhita, Sushrut Samhita, and Stang Hriday, because that was the way of the writing or the documentation of that period.
Yes.
In the same way we have everything. Yes, nowadays what people demand, and that is known as the contemporary, we are doing that also. And one thing more, ma'am, I just like to put all the audience of your channel in this organization, that it is not like that one book is written 5,000 years ago, 3,000 years ago, namely the Charak Samhita and Sushrut Samhita, and only that writing is coming to the 2023. No. After every 200 year, 300 year, 100 year, there is a continuously there is some addition, deletion, commentaries, and all this in Pratisansakar, Tippadi of the every period, 7th century, 9th century, 11th century, 16th century, and even in the 21st century. There are the people who are working in the field, and they are redefining, rewriting Charak Samhita as per the knowledge available nowadays. Even Acharya Sushrut said very clearly that Satata Adhyanam, Paratantra Avalokanam, you have to read your science continuously along with the what is going on in other branch of the knowledge, and then you just advance yourself in your subject. So this is totally a wrong perception that things in the Ayurveda is not documented. Everything Ayurveda is documented. The way of writing was different, because that time that is the only way of the writing.
Correct.
Yeah. And That is the everything is on the experiential evidences, observational therapeutics, you can say, and certainly they did their best.
राइट सो सर अभी आपने मेंशन किया यू सेड दैट सुश्रुत संहिता चरक संहिता सो माय पॉइंट और माय point of concern here is
Yeah,
it because everything is written in Sanskrit language and ancient
yeah,
knowledge that is the
yeah.
reason why people are not able to grasp it and not able to relate it as compared to modern medicine.
It may be one reason. It may be very solid reason, ma'am,
Huh.
because Sanskrit learner or the understanding of Sanskrit is very limited.
Very limited, true.
And English is just a universal language.
Yes, yes.
So whatever things are written in English, people go through very thoroughly on that way.
Yeah.
And on that literature or that report or that, paper. But
Yes.
for Ayurveda, it is the point of the Sanskrit. Then certainly it's a barrier for most of the people.
Yes, yes.
And but I can say that nowadays translations are available. English
Huh.
translation, Hindi translation, Marathi translation, Kannada translation. In every vernacular language, translation of these samhitas or these literature of Ayurveda is there.
Hmm.
And some Vadyas of these regions
Yes.
had already had written all these Ayurvedic knowledge in their own language, in the Tamil, in the Malayalam, in every language it is. So language is not a bar.
Hmm.
Bar is perception.
Perception. Hmm. Because there is a lobby of modern
Yes.
medicine supporters who do not want to recognize the ancient knowledge and powerful scientific proved treatment stream that we have. Now, my next prashna to you is this only, sir. Uh, we are
Just
from the
excuse me, madam. Just I want to complete it.
yes, sir.
That powerful lobby having a reason,
Mm-hmm.
and that reason is the economy only and nothing else.
Hmm.
Yeah, please continue.
Right, right. No, agree. Completely agree.
Yeah,
It's a known fact. It's not that we are talking something new.
yeah.
My question is, sir. You know, I belong to the generation wherein my elders would treat us with some home remedies before they go to the doctor for anything. Whether it could be cold, fever, or it could be some sort of a pain, or it could be some sort of a discomfort, and even many other things. Now, my question is: this is was known to our people very well before, and it was in the families. Unfortunately, now that it is promoted very strongly and very loudly that allopathy is the way to treat quickly and effectively. Now, every second person wants to become an allopathic doctor, specialist, and then they want to make a lot of money also out of it. So, sir, is English medicine more effective, more powerful, or Ayurvedic medicine is more effective, more powerful?
If I understand your question, you are asking that which medicine is the more powerful and the more potential. Okay, my answer will be a little bit different from your expectations.
No problem.
Right,
No problem.
right, right.
We are here to
See,
discuss and understand. Yes.
yeah, yeah. Every pathy, I'm not limiting myself to the allopathy or the Ayurveda. Every pathy has its own domain, its own potency, and its own canvas area for the treatment.
Right.
Undoubtedly,
Mm.
undoubtedly, the allopathy is leader in the case in the terms of the quick action.
Okay.
They have this wisdom of the surgery, and they Ayurveda is also having the surgery. The father of surgery is the Acharya Sushrut. It is said by the FRCS in the Adelaide and many things. No,
Yes.
I do agree here with this perception of the public that modern medicines or the allopathic molecules are showing quick action.
Mm.
But it is a concept also that the Ayurvedic medicines work slowly. But it is not absolute truth. It is half truth.
Mhm.
Here we have rasausadhis in Ayurveda domain. which are the made by the different kinds of the metallic and the mineral compositions. And those rasausathis are known for their quick action in the equivalence of the whatever these allopathic medicines are doing. Okay. So rasausathis branch of the discipline of the this Ayurveda is showing the same rate of action what a allopathic medicines
Allopathy would show.
have. But this is true. I agree here with that. The if comparatively in totality, the quick action is there on their part. That is the allopathy. Ayurveda drugs will work on a different principle. They subsidize all the symptoms, target the cells completely. Here we work on the srotas, here we work on the whole system, where we work on our drugs work on the samprapti vigaton. So certainly it will take time and it will repair, manage, and then it will come to the ultimate result. And they are shown,
Quick,
shooting,
quick.
quick, and damaging others also in the relate all the area in the adjacent. So,
So
this is the
there's one
case.
very famous person, I would not name him, but he has very well mentioned that all the tablet or injection that I'm taking is going through my liver, and then it is damaging my liver every time I put one tablet in my mouth. And likewise, from the birth to how many years, we are always on some or the other medicine for whatsoever reason, especially metropolitan people. So how much damage I had done to my liver?
So I can say only thing that he is very right. Whatever the chemical molecule we are taking, that is going through our metabolism. And the liver is the essential or compulsory part of the metabolism. So it is very true that you see, certainly you have heard that अरे वो आदमी तो कभी नशा नहीं लेता था, कभी उसने कुछ लिया नहीं, लेकिन उसका लीवर फिर क्यों खराब हो गया? तो ये जो क्वेश्चंस आते हैं कि ये उसका लीवर क्यों खराब हो गया, तो इसके पीछे की रीजनिंग यही हुआ करती है कि उस आदमी ने जो है कहीं ना कहीं ऐसी चीजें जो ली हैं दैट इंजर्ड हिज हर लीवर, and that may be a medicine even, that may be a simple paracetamol, that may be a simple, now this capital of India, that is the metmorphine, that may be the anything like brufen, whatever the we are going and we are taking. So certainly liver is the organ which must be respected by each and everyone. That's true. But
Abhi, you only mentioned, sir, that Ayurvedic medicine works on the disease as whole. It will work on the system completely. Allopathy will fix only the symptom.
Target cell.
Yes, only the symptom. Now, I have one devil advocate's question to you. They also say that there is a lot of metal content in the Ayurvedic medicine. That gives a good amount of side effects to people.
Yes,
now,
good.
is it because of our lifestyle we are not able to adopt Ayurvedic therapy? What is your view on that?
See, once again, that is the ignorance. And here, with the ignorance, here is a little bit arrogance too. Yeah, of those people who are talking in this language. See, I'm giving you with the example.
Please.
These metal and the minerals. This human civilization wanted to use as a medicine since beginning. Second AD, there is the Galen, Celsus, Paracelsus, all these Europeans tried to make these metals into the form of a medicine. Even they tried to use the mercury as a medicine. They tried to use this calomel for the syphilis. They tried to use gold for the youthfulness. They have given the liquid gold to a queen to maintain her youthfulness, and ultimately she died, and the gold was in the hair of that queen. In the same period here, the 5th century, Acharya Nagarjuna and little bit earlier started experimenting on these metal and the minerals. In Bharat, 500 years we took to develop the process of the Sodhan, Maran, Sanskar. Sodhan means purification and the potentiation. Maran means incineration, calcination, conversion into the form of the Bhasma. Sanskar means a lot of changes, pharmaceutical procedures to make it agent for the therapeutic uses and free from the any kind of the adverse or the side effect.
Okay.
So after 1,000 years of the researches, we have started it using into the Ayurveda and 11th century in the Chakrapani Chakradhar, and onward it has been used in the quintal and the tons in country. We use 40 tons of mercury nowadays for the Ayurvedic medicines per annum. Wow. 40 ton, right? And forget about the what to ton gold and the silver and the other things.
Other metals.
People are not knowing, people are having this very poor knowledge, very poor
Very
understanding
limited
that
knowledge.
yeah, that is these Ayurvedic people are taking gold and doing, and they are just reducing its size and making it powder as a metal powder and giving for as a medicine. No, it is not. We are treating it very individualized manner, very systematic manner. We can't change the herbs indicated for one metal. That is specifically for that metal only. If it is the gold, then there will be the only Kanchanar. If it is the law, then there will be only Trifla. If it is the Manasila, then there will be only August. There is a system made by our child. I said, 1,000 years they took. And here, these Europeans failed. They could not develop this process of the potentiation and the purification. They could not develop this calcination and the incineration. They could not develop those pharmaceutical processes by which we are making these industrially toxic material. I am using this word, industrially toxic material, into the form of a magic remedy. And that we Indians did. And that is the only point where we are having upper hand. And it is the human tendency. If I am not knowing or I am unable to that one, that is a faulty thing. So these Europeans or these Western people are of this opinion because they know. They tried it for the 1,500 years. You see, 1826, there is a document into the American Defense Library, uses and abuses of the mercury. And they have given the whole history, how much they tried to use mercury for a therapeutic purposes, but they failed because they don't know the Ashtadha Sanskar, what we are knowing. Yes. And we are converting this mercury into the form of medicine. Yes. We are converting this gold into the form of medicine. After a long process, Sahasrapati Abra Bhasma will take 7 years to prepare. So these drugs are so effective. And see, madam, if you see the prescription of any Ayurvedic leading physician, they are using it. Here, one thing more. If it is manufacturing is compromised, if Sodhan process, Maran process is not done properly due to any reason, if dose is not proper, if duration has not been taken care, if Anupan is not there proper, certainly this will be toxic. And if water will be taken in extra amount, that will be toxic for the human body for more than 6 liters. If you are taking food too much, there will be the food poisoning.
No, but doctor.
Yes, use.
Yeah. In this context, I want to ask you. That's the reason I stopped.
Yeah, please.
See, the thing is, it's wonderful treasure and very good treatment way. And we do believe that it has been our ancient way of treatment. However, with the pollution around me and the very adverse lifestyle that I need to live due to whatever development or globalization you call it, I am not able to stick to the scheduled timetable, pathya that Ayurveda advises. And then how can I balance this?
We have to go with the time. And every knowledge must amend as per the need of the time. So it is true for Ayurveda also. So when we talk about the Brahm Muhurt mein uthna, and when the Brahm Muhurt is the just like the night shift,
Yes.
so when will be the Brahm Muhurt?
Yes.
Right? And the half of the young India is working in the night shift.
Yes.
Whatsoever the job is there.
Yes, yes.
Yeah, it was not that period when, except Chaukidar, everyone is sleeping in the 10th, 11th century.
True.
But here, see, Dr. Murthy, Narayan Murthy is talking about the 17-hour work and more than that work also. Yes, yes. Yeah. So that is the point where we have to keep ourselves transforming as per the time. So Dincharya, Ratricharya, Ritucharya, what has been quoted in the classics of the Ayurveda back 1,000 years, that is applicable to that day society and that day working culture and that day social strata. Now it is completely changed. Those regimens or those things cannot be followed in totality now.
Yes, yes.
In totality now, that is impossible. Yes. Not feasible at all. Yes. But we taking the principle of those, we have to use all these things practically nowadays. Correct. We have to respect principle of those. Yes. Not their whole directives, but as per those days principle. Yeah. If I have to sleep 6 hours, I must sleep 6 hours. Yeah, in the food system, in the dietary regimen, everything on that way, it is possible. If you are just avoiding burger, pizza, etc., fast food in the one word, that will be really beneficial for us. If you are avoiding aerated drinks, that will be beneficial for us. If you are taking yogurt and the other things or the shakes of the fresh fruit, that will be the good for us. When we should take curd, what has been indicated, that will be good for us. How we will take bath, that mechanism of the bath, that tub, that oil, it is impossible nowadays for today's. Absolutely, yes. Yeah. Yeah, nowadays, apply the oil, sit for 15 minutes and take bath. Just not possible. No, I'm saying it. It is impossible. I'm accepting it. I see here somebody says to us, even in our Ayurveda, and when we are making our interactions with those people, so somebody says that you teach Ayurveda, we preach Ayurveda, we practice Ayurveda. Okay, fine. You do Ayurveda in way you want, but respect the principle. And if you respect the principle, you will be benefited. So things should be nowadays even. See, madam, we have changed a lot of doses forms of Ayurveda. Okay. We are not preparing churn in that way. Achha. What was prepared back 500 years. I see. We are preparing tablets. We are preparing capsules of the oils which were in a container nowadays. Yeah, we are preparing all these basti and the all dravyas in the different with the technical applications. Many things of the science we have already incorporated into the Ayurveda and we are servicing the public. In the same way, we are just redefining some our principles also with the light of the new knowledge of the science. And you see in our book, Rastarangani, everything of the chemistry is there. And that everything is going on process. So if someone is saying, no, see, okay, they have given a lifestyle. They have given कि आपको बाएं करवट सोना है, दाएं करवट सोना है, पहले आपको बायां पैर बिस्तर पर रखना है, फिर दायां पैर नीचे रखना है, फिर आप रजस वाला है तो आपको इतना इतना काम नहीं करना है, आपको इस तरह से दर्शन करना है. Impossible. No one can do all these things. दायां बायां पैर उठा करके लोग बिस्तर पर नहीं सोने जाते हैं. है ना? तो लेकिन अब वो उस समय की बात थी, उस समय की संस्कृति थी, उस समय पॉसिबल भी था. उस समय पॉसिबल था, उस समय लोग कम थे तो वो लोग करते थे, उन्होंने लिखा और निश्चित रूप से वो बेकार चीजें नहीं है. ये भी मैं कहता हूँ. ये वो एक अच्छी व्यवस्था है थी और उसको फॉलो करना चाहिए. लेकिन हमारा दुर्भाग्य ये है, हमारी जनसंख्या में इतना विस्फोट हो गया, हमारे पास जगह की इतनी कमी हो गई है, हमारे पास संसाधनों की इतनी कमी हो गई है कि हम उनको प्रैक्टिस में ला ही नहीं सकते। तो हमें आयुर्वेद, हाँ, आयुर्वेद के उस मूल सिद्धांत को आदर करते हुए जहां तक हो सके युगानुरूप सिस्टम से अपने आप को करना है, वो चलाना है। तो हमें रात्रिचर्या, दिनचर्या, ऋतुचर्या, जीवनचर्या प्रिंसिपल पर चलना है, और स्पेसिफिकली आज जो हम कर सकते हैं, अपने आहार को संभाल सकते हैं, वो सबसे इंपॉर्टेंट है। वही सब, उसको हम संभाल सकते हैं, उसमें कोई बिगड़ा हुआ चीज नहीं है। हम अपनी आहार विहार को संभाल सकते हैं, लेकिन वातावरण तो हमारे पकड़ से बाहर हो चुका है।
बिल्कुल, बिल्कुल, बिल्कुल।
So that is the only point what I am submitting to all the learned viewers of your channel, ma'am.
Yes.
कि you follow Ayurveda in the context of the contemporary facilities, and accordingly everything is happened. We have changed a lot of procedures in our Panchkar. We are using the technology. So technology is everywhere. It must be welcome. Not compromising the principle, facilitating the principles. That is my submission.
Makes sense. Makes sense. Sir, another question is, unlike allopathy, manufacturing of Ayurvedic medicine is not as common as allopathy medicine factories. Very few players are there in this game. Now, what can be done to increase this manufacture also? Because Ayurvedic medicines are costly and availability is another challenge. So, how do we address this problem?
Madam, let me define your question in a different words.
Okay.
See, number of the allopathic modern manufacturing company, what we call allopathy nowadays, people call as a biomedicine.
Biomedicine.
Or the conventional medicine, sorry.
We call it English medicine.
English medicine, अंग्रेजी दवाइयाँ. So, their data is about 24,000 manufacturers. And in Ayush sector, Ayurveda roughly data is 8,000 manufacturers.
Yes.
Right. And this is completely depending on the demand and the supply. So demand of those Angrezi dawais are much more in comparison of the Ayurvedic dawais.
Understand. Agree.
So here is a less number of the companies. Here the most reasonable point where we must address is the maintenance of the quality. Maintenance of the quality of the Ayurvedic medicine. And for this purpose, since last 20 years, government has moved on very, very systematically.
Very nice.
They have introduced in the 2000 good manufacturing practices, and many SOPs, many Ayurvedic Pharmacopoeia of India and the other volumes are published. A lot of changes, amendments in the process of the licensing. There is a lot of changes into the distribution, I mean certification of the for the standardization of the medicine. These all things are happening since last 20 years, and since last 5-6 years it is more vigorously and the more systematically. The e-Ausadi pattern, and this is the result in Banaras where I am sitting. Back 6-7 years, there are the approximately 400
new manufacturing
units of the Ayurveda. But now it is only 50 because government has closed down everyone because they are not following the pattern of the GMP certification.
I see.
So lesser the player but better the manufacturer will be the good. See, certainly you are knowing because you are a good journalist that what happened in the Gujarat in the last month, the Uch tragedy in the Kheda, and all this company of the Silvassa, and what they were doing. Everything is just due to the problem of the department. Ayurvedic drug inspectors are not working. If first they are not.
Correct.
If they are appointed in a state, they are not working.
They are ignorant.
So if they are not knowing, how can they check the system? So these are the regions where we are very much having concern, that is the quality, safety and efficacy of Ayurvedic medicine. But government is working hard on this issue, and the common public also, they are now asking the quality, safety, efficacy. But in the same way, see, I don't know how to say it, how to submit this fact. these our Indian population is very much having belief on anyone. ये खा लो ठीक हो जाएगा, डॉक्टर के पास नहीं जाना है, बस उसको खरीद के खा लेना है। वो 200 रुपए की, हाँ, पान की दुकान से दवा खरीद लेंगे, किराने की दुकान से दवा खरीद लेंगे, बस में चल रहे हैं, साथ में छींक आ गई तो बता देगा ये खा लो, वो खा दे देता है, खा लिए। हाँ, बट वो मैं आयुर्वेदिक डॉक्टर की बात नहीं कर रहा हूँ, किसी डॉक्टर के पास नहीं जाएंगे। अगर खानदान में एक आदमी को किसी बीमारी से डॉक्टर को दिखाना पड़ा, वही बीमारी, वही दवाई सब लोग खाएंगे, तो पूरे खानदान को वही दवाई चलेगी। तो ये एक सिस्टम गड़बड़ है जिसके चलते जी जी हमारे हेल्थ इश्यूज हर फैमिली में बढ़ जाते हैं। ये है, तो आयुर्वेदिक मैन्युफैक्चरर्स की डिमांड आ रही है, ग्लोबल डिमांड आ रही है, एंड आई एम हैप्पी टू टेल यू एंड ऑल योर व्यूवर्स दैट we are exporting even the Ayurvedic medicine, and we are maintaining the quality also. Players are less, but every time, see here, I got inquiries, I can say 2, 3 in 6 months, we want to open a Ayurvedic manufacturing unit. Because people are knowing that herbals will make more market. That is the point which profit is more. More. So what is your advice to them? Whether they should go for it? Yes, they should go for it. Okay. And if they say one or two, my just one day back, 2 days back, I was in the Jodhpur. There is the Dr. Sarvapalli Radhakrishnan Rajasthan Ayurveda University, and there was a 30 participants from all over country. There was a CME, and someone asked me their question: "We want to be in the field of the manufacturing." I said, "Oh, you're most welcome. You will be a very successful person because you see there is a lot of gap." Just I am giving one example. There is the Colgate, Pepsodent, all this. Then there was the introduction of the Dant Kanti going on, having the market. Then the Sri Ravi Shankar Sudanta going on. Then the Colgate Ved Shakti going on. Now Dr. Juneza, Case King, they have introduced 1 month back Dantamadi. It is taking the market. And see the advertisement with the Manoj Bajpayee. There is a one powder of the Maharashtra. It is going on. So here is the space, and many products can be there. So people should come and they fill the gap. So it's going on, and people should come into the area. So adding to this point, sir, this question was not in my list, but now that you are hinting at it, so I thought I will ask that also. Will it be a good entrepreneur startup idea for women as well? Yes. Why not? Going on. And we are talking very, very recent. Just yesterday, I talked to one of my PG scholar, Kanika Nanwal, and I just suggested her to get this cosmeceutical products of the herbal for her research work. And the one PhD scholar is the Miss Aparna, and she is doing on the millets, millet pizza and the millet burger. Yes. And and with the addition of the some medicinal plants, ashwagandha, satauri, and her co-guide is from the CFST, Center of Food Technology of the Banaras University, and they are thinking, and we are doing a lot of work here. And see, the millet is not only for the millet. Millet is for the economy. Yes. Because India is the largest producer of the millet. See, our Honorable Prime Minister is doing everything for the 5 trillion economy. Yes. International Yoga Day. Yes. The whole the business of the yoga. Now International Millet Day, millet is going on. Traditional medicine, Ayurveda, Ayurveda is going on. So millet is the one of the best option. Best option. And it is see, but here is the word of caution. Every millet is not useful for everyone. Right, true. Again, that has an angle of suitable to that constitution. But yeah, and every millet is not good for every disease. Yes. Every millet is not good for every state of society. Yeah, that is also. Every state of society cannot eat every millet because there is a lot of changes in the properties and the characteristics and the final metabolism of the millet. So here is a need of advice of the dietitian is specifically in the from the Ayurveda and the dietary regimen. So nothing is universal, ma'am.
It's a lot of involvement of the experts and having some sort of a plan in place, because as you rightly said, sir, uh, we want things easy. We don't want to get into the details of it.
Yeah.
And we are not, at the same time, I'm not saying we are ignorant, but somehow we do not have that much of time and knowledge. So we want to take somebody's advice handy and want to follow it. Now that person should give us the proper guidance.
Without taking the authenticity of the person.
Yes. Yes, that is one side of it, definitely. So, certification and export of Ayurvedic medicine you just now mentioned. What are the policies? Can anyone export it?
No.
Hmm.
Ayurvedic medicines are being exported in two ways.
Hmm.
One thing is that two way in the both ways. See, in India also, or for the abroad, there are some countries, almost 16 countries, which who recognized as Ayurvedic medicine as medicine. And the rest 100 out of 16, the rest 192 countries, they don't recognize Ayurvedic medicine as a drug or as a medicine. And those countries are also importing, here we call Ayurvedic medicine, but they call herbal supplement. They call dietary supplement. They call some herbal powder like that. But here in India, we call that all everything Ayurvedic medicine. Here, for the export quality, here is a CDSCO, Central Drug Standard Control Organization, that is the part of the Ministry of Health, not the part of the Ministry of Ayush. Ayush, okay. The Ministry of Health, CDSCO, issued a certificate known as the COPP, Certificate of the Pharmaceutical Product, COPP. And to get the certificate of the COPP, there is a compulsion that company must have WHO GMP, not Indian GMP. WHO GMP. And if a drug is recognized, prepared by a WHO GMP establishment, and having a certificate of the COPP, Certificate of Pharmaceutical Product, by the CDSCO, that may be exported as a Ayurvedic medicine, and the companies like Ayurvedisala Kottakkal, like the Charak Pharmaceuticals, like the Himalaya of the Bangalore, and the these Solimics or the Dhupa Peshwar, they are applying continuously to the CDSCO, to the Ministry of Health, and they are issuing the COPP. And with this certification, these are being exported as a Ayurvedic medicine. And other point is that that is the most favorable good, and that is exported by the Ministry of Commerce. And the containers are going on abroad, and but they are not as a medicine. They are the just supplements. And even you in the US also, there is a huge supply. In the European Union, there is a huge supply. And many more players are here. But for the medicine, the COPP is required from the CDSCO, and demands are going on. Every year demands are going on. 1,20,000 रुपए की तो घोषणा प्रधानमंत्री जी ने ही की है अभी कि इतनी डिमांड बढ़ी हुई है. तो so this is a continuing process, and people are looking towards the traditional medicine. And the reasons for this is not only the first time, this is the fourth time that the West and the America is looking to the India for the herbal medicine. First was 1920, but penicillin was invented. Then the 1940, sulfur drug invented. 70s, then range of antibiotics invented. Now everything is giving the side effect and the adverse effect. Now once again they are looking to the herbal medicine and the herbal antibiotic. WHO is able to recognize Ayurvedic medicine as a medicine? Yeah. Okay. Which one? Which one? WHO? Yeah, WHO is recognizing Ayurveda. WHO has published benchmark of Ayurveda second edition, not the first edition. In the 2022, they have published the benchmark of Ayurveda, a good booklet on the Ayurveda. And the WHO is had established a center into the Jamnagar, Global Center, GCTM, Global Center for the Traditional Medicine. And they have defined, see what you were talking about, the metal and the mineral drugs. Even in the New York, California, they have given the definition of the rasa association. They are writing in Indian Ayurvedic drugs, there are some metal and the minerals are used intentionally, and they claim that they have processed it for the its purification and the potentiation. This is the definition given there in the NIH, National Institute of Health, in the WHO. Now they are having open mind and open gate because they know the efficacy. They have collaboration with for the cancer treatment. We know that for the cancer treatment, these resources these are going to United States Pharmacopoeia is working with the All India Institute of Ayurveda, New Delhi, for the treatment of the cancer. So in India, we the I don't want to use many harsh words for those Indians because who have their mind very much
contaminated.
Colonial mind,
Yes.
colonial mindset.
Yes.
Whatever in the India is, that is the
Low standard. Yes.
low standard. That is not good.
That is not good approach. True.
Yeah.
True. Sir, last advice on,
Yeah, please.
and I want you to be really subjective and to the point that the lifestyle choices that have come to us by change in the atmosphere, change in the profession, change in the way we travel to the workplaces, how to maintain the health intact with this many challenges?
Difficult question. It's a really very difficult question you put before me because even I say personally I'm unable to maintain it due to so much travel and due to so much pressure. But one thing, two things I can suggest to me also and to you and all the viewers who are listening us. We have to maintain a good amount of sleep, a light food, and some rest for our own. These three things will make run longer.
Yes. I think people should look Ayurveda as a default way of life. And then once in a while, if you are something really critical that needs a quick treatment or quick attendance, then maybe allopathy is a way to attend it.
Every pathy has its own importance and the significance.
Yes.
If there is a trauma, if there is accident, don't think about the Ayurveda. But if after recovering from the accident and trauma, think only about Ayurveda.
Correct. True. And I think precaution is also the way to look at it. With this lifestyle, if you are able to prevent.
Yeah, lifestyle. If you are operated for any reason, after this course of the English dawaiyan, I mean Angrezi medicines and the allopathic medicine, follow the Ayurvedic regimen for that, see the wonderful result.
Wonderful effect. True.
Critical period of the 15 days, 20 days, forget about the Ayurveda.
Yes, yes.
And then follow it. So everything is having its own importance at own time.
100%. Alright, sir. Shariram adya khalu dharmam. Unless the body is intact, we are not able to do anything. So let's keep it intact. And thank you very much for your time.
Thank you for very nice and very systematic and very informative interview. Thank you.
Namaste.
Namaste.